Tonight, a local policy change following an accident. An Ohio police officer accidentally overdosed after arresting two people on drug charges last week.
So police say the officer nearly died just because the synthetic opioid fentanyl touched his skin. That's how powerful this drug is. News 6 investigator Lewis Bolden did some digging here, found out the incident has already prompted change at the Orlando Police Department. He joins us live outside OPD. Lewis?
Well, Matt, after that near-deadly incident in Ohio last week, this internal memo went out to all employees here at the Orlando Police Department, clarifying how officers are to handle drugs and prohibiting them from testing them in the field.
I never dreamed that that something dangerous would be such minute piece of powder.
Officer Chris Green was helping arrest two men who were in this car on alleged drug charges. Police say the suspects admitted the white powder on the floor is fentanyl. Officer Green doesn't know how some of that powder ended up on his clothes, but when he wiped it with his fingertips, he later passed out and had to be given 4 doses of Narcan.
For simply touching that and or inhaling.
When we saw that story, we said, you know what, we have to make a decision on moving forward right now.
Last week, Deputy Chief Robert Anzueto with the Orlando Police Department sent out this memo to all employees, reading, effective immediately. Any officer who contacts a suspect with a substance believed to be heroin shall not conduct any presumptive field tests.
The #1 priority in all of this is our officer safety.
Police say fentanyl is often sold as heroin, but is much more potent. It is so dangerous and spreading around the country so fast, the DEA made a video warning police and emergency responders of the risks.
Our men and women, our first responders, are going to be bumping into it, and it's extraordinarily dangerous for them.
OPD took action. Deputy Chief Anzueto's memo also reads, suspected heroin will be safely handled using gloves and a mask and properly packaged. It will then be sent to FDLE for testing.
We don't want to put our officers at risk by touching this suspected substance and, falling ill from it.
Now, the turnaround time to get test results back from FDLE is between 30 and 60 days. If a test comes back positive, then an arrest warrant is issued for that suspect. Matt?
Well, there's another issue, though, Lewis. 30 to 60 days for a warrant. That's more time someone suspected of drug activity is still out there on the streets. Does that pose a public safety risk?
Well, the deputy chief says no. He says right now his priority is his officers. Now, keep in mind, this is a temporary policy. The deputy chief is going to be meeting with FDLE and some other agencies, trying to come up with best practices and then to come up with a permanent policy for these officers to follow. Matt?
Such a scary story. Lewis Bolden live for us. Thank you. To get a better understanding of fentanyl and how that drug became the most potent painkiller out there, go to clickorlando.com/health.
Yeah,